Welcome to the Wow MD podcast, where in each episode you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Chernayanu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. Hello, my dear listener. This very brief podcast series will close the year in 2025, and it's mainly about urinary health as women age during and after menopause. Obviously, you know, and if you don't, you're finding out from today's episode that many women suffer from urinary problems. Some of them from early on, starting in their youth and adult years, and it is an ongoing problem as they age, becoming, unfortunately, worse and worse, sometimes slightly getting better, but then worsening or coming back as a woman advances in age. The majority of women, however, do not have major urinary problems until they just about hit menopause, and then it just continues to get worse the years beyond menopause. So there is a certain group of women who have urinary problems their entire life: frequent UTIs, sex-related UTIs, interstitial cystitis, so on and so forth, urinary incontinence after childbirth. But today's episode is mainly gearing around the trouble that happens to the urinary tract of women and their urinary health in the years beyond menopause and with aging. Many women start noticing urinary problems during perimenopause, and I was one of them. And I'll tell you a little bit more about what I went through. So what are these urinary troubles? Well, in many circumstances, the urinary discomfort and problem is an increased need to void and use the bathroom, which we call urgency. When you gotta go, right? It could start out in a very subtle way by simply just waking up at night to use the bathroom. And at the beginning, it's just once or twice. Then before you know it, it crept up on you, and now it's 3 times and then 4 to 5 times. Now, even getting up at night to use the bathroom once or twice is disturbing the sleep quantity and quality, which will contribute to fatigue, irritability, and foggy brain the next day. So imagine waking up 3, 4, or even 5 times or more. So something as simple as waking up at night to empty your bladder can have very serious implications for your capacity to normally function the next day. So personally, I take getting up in the middle of the night to pee very seriously. The need to use the bathroom at night becomes more apparent during the day. So women might find themselves needing to go to the bathroom almost every hour sometimes. Now they also have an increased frequency of urination, which is driven by the urgency. So getting up in the middle of the night to use the bathroom is called nocturia. This might be a term your doctor is using, and if you have no clue what it is getting up in the middle of the night to pee more than once. Urgency and frequency during the day and nocturia, getting up in the middle of the night, are the most common urinary symptoms women will experience during their lifetime. So what is the cause for these symptoms? Well, the medical community put all these symptoms together and named this constellation of symptoms overactive bladder. So I'll talk more about this, but first, I'd like to continue talking about some of the most important urinary medical issues that are affecting women younger and older, because overactive bladder is very, very clear the hallmark of the biggest changes women feel and the biggest problems they experience due to aging and due to the loss of estrogen. Now, you should also know that the constellation of symptoms consisting of increased urge to urinate, increased frequency, as well as getting up in the middle of the night to use the bathroom with an added sensation of pelvic discomfort again, very similar to an UTI without an actual UTI, is a typical presentation for interstitial cystitis. Many women have never heard of this condition, and they have been repetitively and persistently treated with oral antibiotics because they have been diagnosed with frequent urinary tract infections based on symptoms and rarely confirmed by a urine culture. A lot of these visits are phone consultations. Another problem women might encounter during their life, but especially as they age, is painful urination. It is also called dysuria. It is the hallmark symptom for a urinary tract infection, also known as UTI. But if a woman has a rather acidic urine and a vaginal infection, she could present with burning when urinating as the main symptom. So make sure you differentiate. If you have vaginal irritation issues and it burns when you pee, it might not be a UTI. It could be a vaginal infection, and it could also be both. UTIs are well known. Everyone knows a UTI is a urinary tract infection or a bladder infection. So how do they present? Well, obviously, during a UTI, the bladder wall is irritated. Therefore, a woman suffering from a UTI will have urgency and frequency due to the frequent bladder contractions or spasms, as well as some suprapubic pain and pelvic discomfort, especially at the end of the voiding. Like I mentioned before, sometimes it's very hard and difficult to differentiate between an interstitial cystitis flare-up, between the manifestation of an overactive bladder that's extremely severe, or a very acute urinary tract infection, especially in someone who already suffers from chronic urgency, chronic frequency, gets up at night, every night, and instead of 2 to 3 times, maybe she gets up 4 or 5 times. So the symptoms could be very subtly a change in what's her normal in order to tell us what is actually happening. And there is a significant increased risk for urinary problems as a woman continues to age. So as I'm talking about this very important subject, urinary health as a woman ages, let's just take a few minutes to talk about urinary incontinence. That is involuntary leakage of urine with various activities, or just simply on the way to the bathroom. One of them is stress incontinence, when you leak exercising, jumping, sneezing, coughing, running. The other one is urge incontinence, because you leak on the way to the bathroom, you leak when you put the key in the door, you just have a sudden urge to urinate and you can't make it to the bathroom. So there's also patients who have mixed. There's lots of women who have stress incontinence and urge incontinence. They have both. The amount of leakage, of involuntary leakage, can vary from a very few tiny drops, which is not really bothersome to the most women that experience it, to a complete and full bladder release. Highly uncomfortable. This is an episode that will be visible to all who are around to witness the episode. It's extremely embarrassing and significantly restricting a woman's ability to move about and plan her day when these things happen, right? This type of accident can happen at any point without any notice, unfortunately. So severe urinary incontinence can be extremely debilitating. So how common is urinary incontinence? Well, about 30 to 40% of women in their 40s and 50s are experiencing urinary incontinence. And apparently the large majority of women do not discuss this with their physician. There are some statistics that say that over 50 to 60%, perhaps as close to 80% of women, once they reach their 8th decade of life, will be incontinent. So why do women do not discuss this very important, debilitating issue, and an issue that impacts their social life, causes embarrassment and shame and discomfort? Why is this not discussed? Well, whether it is because the woman is embarrassed, or maybe because she has the belief that nothing can be done, maybe it's due to the fact that women know surgery might be required and they're afraid and do not want to consider a surgical option. And there are a multitude of reasons why women do not discuss this specific issue with their doctors. Now, I'm an OBGYN and I have a large array of technologies capable of significantly alleviating, if not completely resolving, the issue of urinary incontinence, so I frequently ask, Are you leaking? And if you are you bothered by the amount of leakage? Like I said, some women just leak very little, only a few drops when they laugh hard or they have a severe coughing spell, and they don't really care to do anything about it. Now, what I've noticed, and this might be something that happens to other doctors, but I'm talking about my personal experience in this episode. Many women downplay the severity of the leakage. 9 times out of 10, when initially questioned, many women admit they're fine. It's bothering me, but I learned to live with it. It's not a big deal. And they pretty much admit they adapted to the condition of leaking. They're really fine and they don't mind continuing to live with it. And there are many, and I mean many therapies available to help improve the quality of life for women who suffer with chronic, repetitive, and persistent leakage of urine, which is occurring unexpectedly and uncontrollably in the form of urinary incontinence. So the purpose of this episode is to raise awareness that urinary incontinence can be addressed. And just to mention a few, outside of surgery, the well-known Kegel exercises, which nobody does. Physical therapy can be very useful. Estrogen therapy can be highly useful depending on the age of the patient. There are medications for urinary incontinence, especially for urge incontinence. There's laser therapy. There's multiple lasers, CO2 laser, radiofrequency microneedling. There's erbium lasers. There's PRP injections. There are Botox injections and bulking agents injected under the urethra to lift it. Maybe even using a pessary. These are just a few and pretty much the most important ones of therapies that are available out there. There's bladder retraining and, addressing bladder inflammation and all kinds of other things, right? Now, the great majority of women who suffer from urinary incontinence have no idea that there are so many options available to them. Most of these options are very affordable. Some are not so affordable and will come out of your pocket because insurance will not cover them. But just think about the money you are not going to spend on diapers or on urinary incontinence pads for the rest of your life if the therapy proposed by your doctor is actually going to work. Yes, it is true some of the therapies like laser therapy and PRP injections are not standard of therapy, but I don't know why they're not. They should be because they work. Not in everyone, mind you, but they work in the large majority of patients. Unfortunately, laser therapy and PRP injections are not covered by insurance. Botox is. And again, this episode is not about pros and cons of each one of them. I'll probably do a different episode about that. But it's more to raise awareness that there are so many options out there. Unfortunately, most insurance plans will not cover laser, PRP injections, but Medicare and insurance might actually cover electrical muscle stimulation provided by an electromagnetic chair or an intravaginal device that delivers gentle electricity, creating repetitive, effective contractions of your pelvic floor, strengthening your pelvic floor. So again, this is not the topic. I want to pretty much make sure that you, my listener, are aware of how important the urinary changes are and how they shouldn't be ignored, and for many reasons. So let me talk for a second about the many consequences of untreated urinary incontinence. There is a huge physical health impact, like chronic UTIs, skin irritation at the entrance of the vaginal canal, and an increased risk of falling and major injury with a fracture, because many times the women try to rush to make it to the bathroom. And all the way to emotional and psychological consequences like stress, anxiety, and significant depression over this, with very impactful quality of life. Urinary incontinence is a nuisance. And last but not least, many women will actually be reducing their social activities. They will stop going out. They will stop interacting with people. They will stop going to parties due to fear of accidents as they get older, which will lead to isolation and significantly decrease physical activity, as the woman will now avoid being active, going to the gym, jumping on the trampoline with the kids, because they're afraid of having an accident. So maybe everything I have told you so far is well known to you. So let me switch gears here and tell you something you probably have not heard anywhere else. I would like to talk about why some of these changes happen. And as it turns out, the lining of the bladder and the lining of the urethra, which is the very small channel through which a woman's bladder empties during the act of voiding, this lining is very sensitive to estrogen. So the lining of the bladder and the lining of the urethra rely on the presence of estrogen in a woman's body to stay healthy. So a woman needs estrogen in the form of free circulating estrogen in enough quantities to be able to interact with the bladder mucosal lining cells. As soon as a woman will experience a decline in her estrogen levels, which will happen during perimenopause, especially during menopause, and obviously there's zero estrogen postmenopause, well, not zero, but slightly above zero, a woman will be more likely to wake up in the middle of the night, not just sweaty and bothered or with a hot flash, but also needing to use the bathroom. Why is that? Well, let me explain. I'll explain in a few minutes, actually. Let me talk a little bit because I mentioned the urinary incontinence and I don't want to get sidetracked and forget. I want to talk a little bit about the pelvic floor wellness. Many women who deliver their children vaginally experience a little bit of leakage afterwards. It gets better, it disappears, and it will reappear during and after menopause. Why? What is it about estrogen that helps a woman maintain stability of her pelvic floor? Well, let's talk about that for a second, because estrogen is not important just for the lining of the bladder to avoid the UTI, but it's also important for the pelvic floor to avoid incontinence. So estrogen is vital not just to support and nourish the healthy, thick, and immunologically strong bladder lining that is able to defend itself against bacteria, but estrogen plays a very important role in maintaining the stability of the pelvic floor muscles and the ability of the muscles and the tissue of the pelvic floor to support the bladder and the other pelvic organs like the cervix, the uterus, etc. Estrogen contributes and maintains the strength and elasticity of the pelvic muscles and the connective tissue that holds the muscles together. If you didn't know, let me tell you, estrogen is responsible for promoting a healthy blood flow into your pelvic floor muscles. And obviously, an adequate circulation of blood flow is essential for delivering nutrients and oxygen to the muscles and the tissues of the pelvic floor, which will be needed to keep them strong and functional. Do you ever wonder why women get to develop more and more prolapse as they get older? Do you ever wonder why women get more and more leakage as they get older? Well, the simple answer is because their pelvic floor gets weaker, muscle-wise and connective tissue-wise, they both get weaker, and their pelvic floor will fail to support the bladder in the same manner it used to when the woman was younger, when her muscles and her connective tissue were stronger, better irrigated by normal blood flow because she had estrogen at that time. Now, it's known to everyone how important estrogen is for collagen production. And everyone knows how important collagen would be to help maintain the elasticity and the strength of ligaments and muscles. And guess what? That applies to the pelvic floor as well. So the better and stronger collagen a woman has, the stronger her pelvic floor will be. In order for a woman to have good, healthy collagen, she needs to have good, healthy estrogen. As a woman loses her estrogen, and as she advances into the decades beyond menopause, unfortunately, her chance of developing pelvic floor muscle weakness will increase exponentially the older she gets. There are many signs and symptoms that women will experience before severe major prolapse. Let's talk about those. These symptoms are very clear, and they should signal a visit to your friendly OBGYN. Leaking urine involuntarily when you don't expect it. Urinating more often than normal, every 1 to 2 hours. Severe persistent constipation and difficult bowel evacuation. Chronic pain in the pelvic region. Discomfort during sexual activity. Lower back pain. Difficulty inserting a tampon. And many other symptoms could easily signal to a woman that steps need to be taken and a full evaluation needs to be done in order to prevent the pelvic floor weakness from reaching the point of no return, where surgery is absolutely necessary to correct it. However, many women choose to ignore these symptoms. They hope that they will get better. Unfortunately, they will not. Please remember this as the main message of this podcast, very small, very short series. As a woman's journey of aging will progress into menopause and the decades and years beyond menopause, her chance of urinary problems and pelvic floor problems will increase as she gets older. Many women and their doctors ignore this. And it is a big deal. Big deal enough that I thought doing an entire episode about it would be useful. It is a big deal for a woman's quality of life. What if we could prevent all these urinary issues in older women by treating estrogen deficiency early on? Food for thought. Especially now as the FDA has removed the black box warning on many therapy estrogen products, after obviously 20 years of wrongfully labeling these estrogen therapies as being dangerous. Maybe doctors who treat women will be more curious about the benefits of estrogen. Maybe medical schools and residency programs will introduce curriculums, including training in estrogen therapy for upcoming generations of doctors. But hopefully, this episode will first and foremost open the minds of women who fear estrogen, but who could use estrogen to help them live better lives, allowing true enjoyment of their golden years. Now, this episode is mainly about what type of urinary troubles are facing women and why they occur as they age. Stay tuned for a future episode in which I will discuss therapy options outside of estrogen, even though, honestly, estrogen is king when it comes to urinary issues. So please remember, estrogen is always a possible solution for all the urinary troubles caused by menopause, including pelvic floor dysfunction and pelvic floor weakness. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas, so please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.